All right, my name is Dr. Trent Frisch. I'm one of the chiropractors here at Brookdale Health, and I'm here with...
My name is Dr. Aaron Horn. I'm a chiropractor as well.
And we're just going to chat with you a little bit about what we see on an everyday basis from a chiropractic standpoint, you know, how we approach treatment, how we help patients through the process of overall resolving these injuries, and ultimately just getting them back to where they want to be in life and taking care of family, getting back to work, things like that. So a lot of the times with these auto accidents, when we get these patients in, they're fearful, you know, they're having concerns, their car just got banged up, they're injured, they got to take care of kids, got to take care of work. It's a little bit of a whirlwind, isn't it, when we get them in there?
It's very overwhelming for them. And that's something that we can help them out a lot with, not just with their health and their pain, but also all of the paperwork, all of the stress that goes along with insurance claims and not knowing exactly what to do or how your benefits work. We can assist people with all of that because we have so much experience in this area.
Yeah, and I mean, the biggest thing is when you get that patient, and you probably know this when you see them, is just calming them down. It's just being that calming voice to them, going through the process saying, hey, we'll take you through, we'll guide you, kind of almost taking them by the hand.
Yep.
And the big thing I see a lot of the times, and you can correct me, maybe you see something different, when you see a patient come in, it's, you know, taking them through that history and intake and learning a little bit more about their personal life, a little bit about, you know, family and things like that. That's why we ask those questions. And you get some of those patients, they come in and they're just, you know, anxious, they're nervous, they're worried about everything. And once we get them through that process, you just see that alleviate over the weeks.
Yep. Yeah. I mean, we learn about their job or their family, things that they'd like to get back to doing. Maybe they're off work. A lot of times that's the case. They can't work at first, and we work with them through what they can and can't do and help them start to gradually return to their everyday activities and work.
Mm-hmm. And I mean, I just had the other day a patient was talking about, well, my work won't let me back. It's a physical job. They've got a significant back injury. They can't bend, lift. They didn't know about the options available, and there's certain options in Minnesota. You can apply for disability, you can FMLA, all that stuff. So it was great to help that patient through that process, and you just watch the weight on their shoulders kind of ease because they're like, okay, now I know I have a direction, I have guidance to where I need to go. And just seeing that in an everyday patient is great, but most providers don't know how to deal with that. Here at Brookdale Health, we do.
Absolutely, yeah. We deal with it every single day. We're very experienced in it, so we can guide patients through all of the different options that they have.
Mm-hmm. And then, obviously, when we're recovering from the injury, we're going over home exercises, stretches, things, altered ways of doing things. Like, I had a patient the other day, they were saying, well, every time I bend over the tub to bathe my kids, my back spasms, so we had to review kind of, okay, try this technique, do this. And then they come back the next day, oh, my God, that helped so much. Thank you so much. And it's just being more personable and not so much cold and uninviting. Sometimes you go to the bigger outfits, they're like, they didn't barely talk to me. They met with me for 2 minutes. We at Brookdale Health care about our patients and care about their progress and getting them back to where they want to be.
I agree 100%. I enjoy working here because everybody that I work with is really friendly, very caring. They do great work.
Mm-hmm. So is there a patient that comes to mind that you think of when you think about this process in the last week or so?
I mean, there's a lot. Just someone yesterday that I was talking with, talking about kind of modifications for everyday life. They were having difficulty with sitting, doing some of their everyday activities. Mm-hmm. So we talked through some things that they could do periodically throughout their day to help to relieve some of their symptoms, changing their posture, some different exercises and stretches they can do throughout their day. So
nice. And then another patient you and me see, they went through the process, followed the direction. Now they're back playing basketball, and their back's not hurting. They're enjoying back to just full function, which is always great to see.
Yeah, it's always awesome to see that.
Mm-hmm. Well, I would say if anybody's interested in coming to Brookdale Health, anytime you have an auto injury, we're the first place you need to come. We know what we're dealing with. We know how to handle these injuries, from taking care of the injuries to taking care of all the extra busy work that comes with it. And we make it easy, safe, and kind of calming for the patient to make them feel comfortable in this family environment here at Brookdale Health. So I appreciate you coming to hang out today. Appreciate the audience for listening to the video, and we'll do this many more times in the future. Thank you again.